Sciatica. Many of us are diagnosed with sciatica or sciatic nerve issues in our lives. And part of the reason is because the sciatic nerve is incredibly big, it's incredibly long, it's the biggest nerve in our body. And the sciatic nerve, it comes from the lower back, comes into our hip region, crosses through the glute area, into the back of the thigh, into the back of the knee, and branches off when it goes into our calf and lower leg. And that's why when we have sciatic nerve pain or sciatica, we can feel it in a variety of different areas, stretching from the low back into maybe the hip glute region, through the hamstring and lower leg. And we want to think of the sciatic nerve almost like a long intercontinental highway, right? That highway passes through many towns, many states, and along that highway, there can be issues. There may be road closures at different places, there can be construction, congestion, what have you. And when it comes to our sciatic nerve, we can also experience issues at many different areas along the journey. And so, for example, maybe we have compression of the sciatic nerve or issues with the sciatic nerve at the lower back, maybe something like a disc herniation. And then as it passes into the glute or hip region, perhaps it's getting compressed from some of the muscles that are located in that area. Then it goes into the back of the thigh. You can experience perhaps some issues there, and in the back of the knee, into the calf, and so on. So there can be many different influences as to why you may be having sciatica or sciatic nerve pain. And part of those issues can also be just the ability of that long nerve to be able to move. We don't often think of our nerves as mobile structures, but nerves need to be able to move as we move, right? Think of it like a piece of dental floss, right, that I'm holding between my fingers here. Well, that dental floss, that is the nerve, needs to be able to glide and slide as we move. It needs to be able to stretch and shorten as well. And if for some reason that nerve is not able to slide or stretch and shorten properly, well, then we're going to also experience some of these symptoms as well that can present as maybe numbness or tingling or just pain in general. And there's a couple of nerve gliding or nerve sliding techniques that we really like to give our patients. So here is my colleague, Dr. Matt, demonstrating a version where we're lying on our back and where he's showing the ability to have the nerve slide and glide as he bends and straightens his knee. There's also another version that we can do that's a little bit more progressed, where maybe we're lying on where we're standing, and he's doing something similar. So in the beginning, as with the other video, he's doing more of a nerve sliding technique, where the nerve is sliding up and sliding down as he moves his foot and his ankle, and as he moves his trunk as well. So these drills are something we give to our patients that maybe they can do for, let's say, 20 reps at a time, a couple different times a day. Give them a shot on your own. And if you're having sciatic nerve issues, any of that numbness, tingling, or discomfort that can go anywhere from the back all the way down, I really advise that you see a qualified physical therapist to address these issues, because in addition to some of these drills that we showed you here, there is so much that you can do to identify where along the sciatic nerve pathway you may be experiencing some issues, some compression, maybe some increased tension that are causing symptoms, and then be able to get a treatment plan that addresses what those particular issues are. If that's something you're interested in, come contact us. We'd love to be able to help you.